Swayam Prabha. Digital India. Educated India.
Hello and welcome back. This week we are going to look at image registration. We'll have a brief introduction to the image registration, followed by some description of the rigid registration model, rigid transform registration model. So, what is image registration? So, typically, this involves aligning a moving image, moving in the sense the image that is being transformed, and aligning it to a fixed or a target image. So, and in this process, this involves the estimation of a coordinate transformation or a transformation matrix or a bunch of parameters which maps one image coordinate system to another. Okay. So this process is actually an important step in a lot of research studies as well as clinical studies before any diagnosis is made. So we briefly look at the motivation for estimating such a transform. So where are these two images coming from, fixed and this moving image? Why are we doing this, right? So in a lot of these research and clinical studies, especially clinical studies, a series of images are taken. So for instance, a patient walks in maybe with some complaints in some part of his anatomy, let's say chest or liver, etc. Right? So they would do a preliminary imaging scan. The radiologist would then recommend maybe a CT image or an MR image. So this registration typically applies to a lot of the tomographic imaging techniques. We saw, right, the imaging techniques that produce cross sections of the body. So now the same patient might walk in a few months later, and then you want to image the same anatomy and compare them. Okay, but then before comparing them, you would like to make sure that they are aligned, in the sense you are looking at the same scene in both the same slice or the same locations in both time points. So before you overlay one time point over the other, it is important that these two time points be registered. So that's where the process of registration comes from, right? This helps not only just for diagnosis, in the sense you also want to see whether any changes are there in the anatomy over time. Okay. The alignment is required. So you might say, well, it's the same patient. In this case, we are talking about the same patient. Then why would you need alignment? Because the problem is that even though these images are of the same patient, they are taken at different time points and they will not appear the same. Primarily because the orientation of the patient, the way he lies in the scanner bed, where the body is oriented, etc., might be different. In addition, the anatomy is not strictly rigid, so there will be some deformation of the anatomy as the patient lies down, and it will be a different deformation every time a patient lies down. So that change is always there. So some example where you can expect the cross section to look exactly the same is basically when you are looking at the skull. Right, skull is a very rigid object, so you should be able to match the same locations in the skull, or same cross sections in the skull, taken at two different time points. But these are primarily from a diagnosis point of view, right, wherein you are actually monitoring the patient over time. Okay, and then you would like to see whether there is some disease progression or cessation of the disease. The other motivation would be complementary information. For instance, PET CT or PET MR or MR and CT, where the patient has undergone both CT and MR scans, and we have seen before in our introductory lectures that they provide kind of different kind of information, right? So you would like to merge them and see, but before you merge or fuse those images, you would have to align them so that the anatomies line up exactly. Okay, so this is another application. So PET CT imaging, for instance, it is pretty much a solved problem in the sense that now there is a PET CT scanner where the patient lies in the same bed and the scanner itself has both the CT and the PET component, so the registration problem is slightly less problematic, right? In the sense, it's easier to do the registration in this case. There are other situations wherein you need, for instance, high quality, high resolution information. But then, when you, for instance, if you're doing surgery, right? So during the surgery, image guided surgery, for instance, there is usually a very high resolution pre-operative image, and during the operation they might do something like an ultrasound, which might not have such a high resolution as compared to, let's say, MRI, and it would be good to align the intraoperative and preoperative images. So here too, again, image registration, the process is comes into play. Okay, so here is some example. So for instance, this is from the review paper by Hill and others. So here, if you see what is shown here are 3 columns A, B, C. Each one of them are basically an average of 7 patient brains after alignment. Okay, so the leftmost column is basically the rigid transformation based alignment. The middle column is the affine transformation based alignment, and the rightmost column is basically the alignment after non-rigid registration. So why do we do this? So basically, a lot of research studies, instead of comparing a single patient to a single patient, or comparing one patient at a time, for instance, scientists might have multiple cohorts. Okay, and then maybe they will choose one cohort as probably a gold standard for comparison. Instead of choosing one image from that cohort, you would like to have an average image of that cohort, but then you can't randomly average, you have to align them and average. So this process is shown on the right, where you see this 2 different colors, right? Blue and that other color, show the the outline of the brain as well as the components of the brain. These are 2 different images. This is before alignment, so you just take those images and then overlay them on top of each other. After that, after alignment or after registration, you would see that both of them align perfectly. There are some blue streaks here and there which shows regions of misalignment, but in general they have been well aligned. Okay, so this is again taken from Simple Elastics. It's a toolbox for image registration. Okay, so there is a wide variety of applications for image registration. So the important application being that you would want to align the same patient's image taken at different time points or with different scanners, or you would like to align a bunch of patients' scans in order to produce an average scan that you can compare other patients with. Okay, so in all these applications, of course, like I said, registration plays an important role, and there are broadly speaking, you can based on the type of transformation that you use, they can be divided into rigid registration techniques, or rigid transformation based registration techniques, and non-rigid registration techniques. So this week we will look at rigid registration techniques.